Okay, hello everyone. So this is an agent that was built by Chukwuemeke Cephas. So this agent is primarily an agent that would help primary healthcare workers deliver their duties very well. So this agent is really trained with some of those activities, the knowledge base of those activities that healthcare workers in the primary healthcare center actually carry out. So things like vaccination and some of those basic healthcare services that are offered. So this agent is a basic agent, but going forward, things like integration of the electronic health record. When you integrate EHRO, it can now be tailored for specific purpose and even increase its efficiency. But then this is a basic agent that serves the primary healthcare sector. So now we just want to query the agent. Let's see what it can give to us. So please, can you give me the vaccination regime in Delta State, Nigeria. So we can see the responses. Certainly below is a routine vaccination regime used in Delta State, Nigeria, which follows the National Program on Immunization under the National Primary Health Care Development Agency. So when you go through this, you can see at birth, within 24 hours, you administer BCG, which actually prevents tuberculosis, and you can see OPV, hepatitis B, and then at 6 weeks, you can see the different things that could actually be administered as well. You can see, right? You can see the responses tailored to the healthcare sector. Also, this can be helpful should in case maybe in a primary healthcare center, sometimes some of these nurses may not know some of the signs and symptoms. You can say, okay, for a patient with rashes and a yellow eye, what possibly can be wrong, and what should I do? So you can see the responses. The combination of rashes plus yellow eyes is clinically important and should be taken seriously in primary care. I will walk you through what could be wrong, danger signs, and what you should do immediately without making a definitive diagnosis. So just like we just need to quickly know that this agent is not designed for diagnosis. It's primarily designed to help the healthcare workers, right? So if there are some key things that needs to be diagnosed, it can be referred to the doctor, right? So this is basically to help the healthcare workers understand the basic symptoms and some other activities as regards vaccination, right? So you can see the responses. Common and important possibilities. Viral hepatitis, you can see why it fits, right? You can see different this is severe malaria with jaundice. This is also an option. Drug reaction / drug induced liver injury, so this can also be a case. Sepsis or severe infection, right? So you can see the symptoms, the reason why it fits. So some of these key things would help we guide the action of the healthcare worker, right? And if possibly can even ask some more questions. So what should you do at primary care level? Step 1, you can see you can ask, these are some of the questions that can be asked. When did the rash start? When did the eyes turn yellow? Then is there fever? Is there dark urine? Pale stew? Any recent drug or herbal medicine? Any known hepatitis exposure? Recent malaria symptoms? So some of these questions are what can be asked and then also fed into the agent so as to help narrow down what the case is. right? So that's basically what this agent does. And then this agent helps to subsequently would help to give some specific diagnosis to patients when the electronic health record has been connected. Talking about the EHR, so that when the EHR is connected, it can now help get specific responses for individuals that visit the healthcare, and this can be integrated seamlessly so as to improve healthcare in Nigeria. So you can see, based on what the responses, you can say, help me draft a referral note. So you can click on just help me draft a referral note. So this referral note can be used to refer the patient if there is need for that from the primary healthcare level. So you can see, so in this referral note, it can be quickly filled in when you input some of these details. Some of these details are imputed and can be filled in, and all you need to do is just to download and give to them to help the referral purposes. Thank you very much.